And welcome to this community briefing. Joining us once again to provide interpretation is Margie Prop. Thank you so much, Margie, for providing your services, and thanks to all of you for tuning in to learn more about the latest local developments, how to keep yourself and your loved ones safe, and how to help end this pandemic. My friend Kim recently posted on Facebook about how grateful she felt after receiving her first vaccine. The past year has challenged our capacity to feel grateful as we cope with a global pandemic, but Kim pointed out how fortunate we are to be part of the only generation of humankind ever to receive a vaccine for a plague experienced in our own lifetimes. Just consider for a moment how during the 1918 pandemic, there was no hope for a vaccine, and there were no therapeutic treatments. Scientists at that time did not even know exactly what a virus was. And amidst the grief and the loss we all have experienced this past year, we can truly count ourselves fortunate to have a means to end this pandemic. Thanks to advances in our understanding of pathogens, thanks to the dedication of scientific researchers across the globe, thanks to the incredible financial investments made by philanthropists and our federal government, we have multiple safe and effective vaccines available that can help us prevent illness and save lives. Yet the vaccine can only accomplish its tasks in partnership with each one of us. Each one of us has the power to help end this pandemic by rolling up our sleeves and turning those vaccines into vaccinations. I'm pleased and proud to report today that the people of Lincoln and Lancaster County recognize the incredible power they have to help end this pandemic and get back to enjoying more familiar ways of living and loving one another. Local demand for vaccines remains high. In fact, over 75% of our residents aged 65 and older have now received at least the first dose of vaccine. This is both a huge community-wide accomplishment and a huge community-wide relief, as we know that COVID-19 has preyed upon our seniors, claiming their lives in disproportionate numbers and leaving too many of their chairs around our dining room tables empty. Further proof of our progress toward the end of the pandemic lies in the fact that nearly 30% of Lincoln Lancaster County residents aged 16 and older have been fully vaccinated. And this week, our health team and their partners plan to administer more than 30,000 COVID-19 vaccine doses to residents of our community. We will continue to advocate for a greater supply of doses to be allocated here where demand for vaccinations is so high. In the meantime, as we work to increase our local supply, anyone who wishes to receive a vaccine should register now with the Lincoln Lancaster County Health Department by going to our website, covid19.lincoln.ne.gov, and clicking on the Vaccine Information tab. Those who don't have online access or who need assistance may call the COVID-19 hotline at 402-441-8006 to register. Getting registered ensures that you will be contacted when it is your turn to roll up your sleeve, get vaccinated, and help end the pandemic. Ending the pandemic is our community's shared priority, and as such, you need to know that amidst all of the incredible progress we are making together, there remains a need to stay faithful to the precautions that have become so familiar to us in this past year. We need to continue to slow the spread of the virus by wearing our masks, washing our hands, watching our distance from one another. Community transmission of the virus continues at a steady pace right now, giving the virus and its variants opportunities to make ending the pandemic more difficult. This is a community that likes winning, so let's beat the virus and its variants by staying faithful to those 3 W's and getting vaccinated when it's our turn. As we work together to beat the virus and end this pandemic, we are fortunate to have our Health Director, Pat Lopez, here every week to give us an update on and answer questions about our local progress. And what you don't see week after week is the entire team of local public health professionals who dedicate their lives to keeping us healthy. Over the past year, we have all come to better understand and appreciate the incredible work that they do. And with their dedicated service in mind, we want to honor them and lift up that this is National Public Health Week. And the theme for this year's National Public Health Week is Building Bridges to Better Health. To celebrate our hardworking, compassionate public servants, LNKTV has prepared this video tribute. that, I'll turn this over to the leader of our amazing local public health team, Director Pat Lopez.
Thank you, Mayor, and thank you to the team for a great video. I know our health team will really appreciate it. I really want to thank the entire health department team for their dedication and commitment to health of our community, not only during the last year, but every year. We continue to make great progress in our vaccination efforts. As of today, around 117,000 residents have received 1 dose of vaccine, which is around 47% of the population aged 16 and over. More than 73,000, or about 30%, have been fully vaccinated. This means we're getting close to having a third of our residents aged 16 and over fully vaccinated. As the mayor said, over 75% of our residents aged 65 and older have received at least the first dose of vaccine. Nearly 55% of those aged 55 through 64 have received at least 1 dose. The World Health Organization, the CDC, and a number of infectious disease experts around the world suggest between 60 and 80% of the population may need to be vaccinated to achieve herd immunity. Based on these credible sources, the health department has set a goal of having 75% of our eligible residents fully vaccinated. We continue to see high demand for the vaccine in our community, and we look forward to seeing the percentage of those fully vaccinated increase as more vaccine comes into our community and more people become eligible to receive vaccine. Last week, we focused on providing second doses for those 65 and older, and more than 11,000 people received vaccine, or at least at our 2 large-scale clinics. We also held 2 successful smaller-scale clinics for members of our community who have been disproportionately affected by COVID-19. One was with a second dose clinic in partnership with the Asian Community and Cultural Center. The other was a first dose clinic in partnership with Mount Zion Baptist Church. I want to thank Pastor Combs for his leadership and collaboration in hosting this clinic. Pastor Combs is here today to say a few words about last week's clinic. Welcome, Pastor Combs. Is he here? Oh, I think Pastor Combs is tied up. Okay. We'll keep an eye out for Pastor, and he can join us when he can. If we don't hear from him today, I know we're going to hear from you in the near future, because the clinic was a huge success, and we really enjoyed working with him and the other pastors to make the event successful. They had wonderful volunteers and a great turnout, and we're looking forward to providing another opportunity in our clinic in an even larger scale. We continue to collaborate with the cultural community centers and local churches to host these similar, smaller scale vaccination clinics. Our cultural centers and churches are doing a great job of assisting individuals with registration. Coming up this Monday, April 12th, we will have a clinic at the Center for People in Need in partnership with El Centro. El Centro's Executive Director, Romeo Guerra, joins us today by Zoom to tell us about the plans for that clinic. Welcome, Romeo. I think you're on mute, Romeo.
Thank you, Pat. And thank you, Mayor, for the opportunity to talk a little bit about what El Centro's part in this big effort is. Actually, El Centro has been implementing several initiatives regarding the whole COVID epidemic or pandemic and so forth. We are working directly with UNLC to see if we can get some good information, good data as to why some people are hesitant to get the vaccine, and to what are some of the barriers of getting those vaccines. We've also worked very closely with the health department to put out a lot of information and try to educate our clientele and get them to come to the vaccine to the clinics to get vaccines. And as Pat mentioned, We do have plans for Monday, April 12th at the Center for People in Need to hold a clinic from 4:30 to 7. And we've been very busy getting the information out and actually assisting a lot of folks to get registered. So I know this will be a big event or a good event. And thanks again, Pat, for including us in this effort. Our small part, I'm sure, will help in the overall project. Thank you.
Romeo, thank you for joining us today. And you really don't have a small part, you have a large part. And we really appreciate your partnership and working to make Monday's clinic a big success. We are also hosting several large-scale clinics this week, all at Pinnacle Bank Arena. We have a first dose clinic on Wednesday for people age 49 and up. On Thursday and Friday, we will have second dose clinics for people age 63 and up, and that educators and child care providers. And on Saturday, we will have a first dose clinic for those in food service and manufacturing sectors. We also continue to work with Bryan Health and CHI St. Elizabeth to hold vaccination clinics for patients with serious health conditions that have been identified by their physicians. We have made great progress working through our vaccination phases, prioritizing those who are most at risk. As I mentioned, this week we have moved to age 49 and up. Next week we expect to start vaccinating more residents in their 40s. All residents age 16 and up should make sure that they are registered for vaccine at covid19.lincoln.ne.gov. Those who do not have online access or who need assistance may call the COVID-19 hotline at 402-441-8006 to register. The health department also has interpreters available to assist callers who speak other languages. Our local pharmacies who are participating in the federal retail pharmacy program are already vaccinating people in all age groups. Plans are underway to add more local pharmacies to that program and to increase the amount of vaccine that is going to those in the program. We are eager to receive more vaccine, and we will continue to advocate for more doses in our community to meet our high demand. The good news is that the governor and state officials are working to allocate more vaccine to districts that are seeing higher demand, like Lancaster County. This week, we are planning to provide more than 30,000 doses of vaccine. That includes an additional 4,500 doses of Johnson & Johnson vaccine that we received this week. Some of the Johnson & Johnson vaccine is also being used to vaccinate homebound adults and those in congregate living facilities like homeless shelters, residential treatment centers, and the county jail. We have partnered with Tabitha to vaccinate homebound adults. In ensuring these vulnerable residents are able to access the vaccine is another important part of our vaccine efforts. Tabitha President and CEO Christy Heinrichs is here with us today. Christy, thank you for being here to share information.
Hi, Pat. Thank you for having me, and thank you to you and your team, as always, for the great work that you do, but especially as we celebrate this week dedicated to you. We are very excited also that Johnson & Johnson has arrived and that the day has come where we will be beginning vaccinating those, as Pat mentioned, who are unable to get out of their homes safely. We will start making calls later this week and scheduling those vaccinations, and we should begin the first vaccine in the home on Friday of this week, we hope. So over the next several weeks, it will be underway and hopefully completed in a short time. We are also using the Johnson & Johnson, the one dose, which will work great for being able to provide in the home in terms of logistics. We have appreciated partnering with the Lincoln Lancaster County Health Department, but also Area Agency on Aging, League of Human Dignity, and lots of home care providers across the city. So later this week, you will begin to hear from us to get scheduled. It's not too late to register. So if you yourself are homebound or care for someone who is, it's not too late to register. When you do use the registration, just indicate homebound in the comments. And we look forward to this next step in helping the city get vaccinated and us moving on.
Thank you, Thank you, Dean. We really appreciate the expertise you and your team have provided related to this and other initiatives throughout the pandemic.
Thanks, Pat.
Also this week, the Nebraska Department of Health and Human Services is partnering with Hy-Vee Pharmacy to hold a vaccination clinic for people with intellectual and developmental disabilities and their caregivers in Lincoln. That will be tomorrow from 10 a.m. to 3 p.m. at the Lancaster Event Center. You can find more information on the DHH website, dhhs.ne.gov, in the latest news section. Looking ahead to next week, we will be holding 2 large-scale clinics at the arena. And there will also be a drive-through clinic at the DHHS Test Nebraska site in Lincoln. We will share more details on this in the near future. Our COVID-19 risk dial will remain in the mid-yellow for the 8th consecutive week. This indicates a moderate risk of the virus spreading in our community. While the dial position remains the same, we are now seeing changes that are causing concern and giving us more reason to proceed cautiously. The number of new weekly cases increased from 324 this week ending March 20th to 360 this past week ending April 3rd. That is not a large increase, as it represents about an 11% increase, but is the highest number of weekly cases we have seen since 423 the week ending February 6th. I'd like to introduce Raju Karkapaludi, our public health epidemiologist supervisor, who will provide some further information on case breakdown and vaccination by age groups. Raju?
Thank you, Pat. Thank you, Mayor. And thank you to everyone who are being vaccinated and to all our volunteers and partners who are helping us in this large endeavor. First, the test that I'm going to discuss today is cases by age group in the past 5 months. We began vaccination in Lancaster County since December 16th, when we first received our first allotment of vaccines for healthcare workers. After we completed Phase 1A in the end of January, we started vaccination in Phase 1B since the first week of February, starting with 80+ population and going down the age groups each week. We have seen some remarkable turnaround in cases and hospitalizations in each group when we completed the vaccinations. As you can see in this table, since the end of January, in each age group, we completed vaccinations. The cases have reduced in their respective age groups. In chart 2, in January, we had 4,064 cases. In February, we had 1,398 cases. And in March, we had 1,519 cases. A significant drop in cases compared to January, but the trend in cases has been relatively flat in the past 8 weeks, even though we had seen a 10% increase of cases in last 2 weeks. As you can see from the chart, the blue bar represents January, the orange represents February, and the gray bar represents March. As we completed 2-dose series of the vaccinations in 65+ population and working down the age groups, we are seeing a drop in cases in these age groups that are fully vaccinated. Since we are seeing around 330 to 360 cases a week in the last 8 weeks, the cases in unvaccinated groups, 50 and under, are seeing an increase. Compared to January, we are seeing a lot of progress, but we are especially concerned about rise in cases in our under 18 population in March compared to February. The trend in cases in Lancaster County compared to state since December. Currently, 7-day rolling average of cases in Lancaster County is 52 cases per day. And for the state, it was around 240 to 250 cases per day until 10 days ago. In the past 10 days, the cases in the state started rising to around 440 cases a day. And locally, we are seeing a 10% increase in cases per day week over week. Thank you.
Thank you, Raju. We've seen a slight increase in the total number of COVID-19 patients hospitalized locally, especially among Lancaster County residents. We averaged about 14 local residents hospitalized at the end of March, but the number has increased in April. The 24 local patients reported yesterday was the highest since March 6th, when 26 local residents were hospitalized. Today, 22 of the 27 hospitalized patients are from Lancaster County. As Raju mentioned, Lancaster County is not alone in seeing our indicators change. We do have some good news to share about our data. The number of COVID-19 deaths in our community has decreased from 45 in January to 23 in February to 6 last month. We saw no reported deaths of long-term care facility residents in March and fewer new cases in those over the age of 65. While each death is a significant loss for our community, we are very grateful that our community efforts to prevent COVID-19 related deaths is really making a difference. As we said earlier, the COVID-19 risk dial remains in mid-yellow, which means that the risk of the virus spreading in the community is still moderate. The map shows how our local metrics are plotted to determine the position of the risk dial. The metrics of the contact tracing, average testing, turnaround time, and the death rate are all near green. Hospital capacity has moved into the lower yellow. The case rate and positivity rate are in the orange category, and the metric for vaccinations is in the red category. You will find the location of the risk dial in yellow at the middle of the chart, represented by the blue square outlined in red. We started using the COVID risk dial last May, and since that time we have had 5 primary indicators: positivity rate, cases, testing, contact tracing, and healthcare system capacity. We've been in the process of reviewing the metrics for the dial based on the availability of additional data, and we will discuss this further in more detail at next week's briefing. I want to emphasize again that even as more of our residents become vaccinated, we need to remain diligent. We are seeing an increase in the COVID-19 cases in many states, including cases from new and emerging COVID-19 variants. These variants have the potential to spread more easily, cause more severe illness, and require different treatments. Just yesterday, we confirmed 4 more local cases of COVID-19 variant B.1.1.7, also known as the UK variant. The number of local cases of COVID-19 variants is now up to 7, 6 cases of the UK variant and 1 case of the B.1.429 variant, known as the California variant. Because of what we are seeing now locally, across the state, and in our nation, we are not making any changes in our directed health measure at this time. The current DHM will extend through April 23rd. At that time, those 65 and older will be fully vaccinated. Until most of our community is fully vaccinated, we need to continue to limit the spread of the virus with the consistent use of public health prevention strategies, wearing masks, watching our distance from others, washing our hands, and avoiding the 3 C's: crowded places, close contact, and confined spaces. Even if you've been fully vaccinated against COVID-19, you should keep taking those everyday precautions in public places. I see Pastor Combs is able to join us, and I'm going to invite him up to say a few words about our clinic last week. Pastor Combs?
Good afternoon. I have been asked to say a few things regarding the vaccination clinic that we had hosted at the Mount Zion Baptist Church just last week on Wednesday, and we have to firmly say that we are glad it could happen, and we are pleased to announce that it went well. We were able to provide vaccinations for over 270 persons, and we are looking forward to more continued and concerted effort in that area. The next vaccination clinic that we will have hosted at Mount Zion will be on April the 21st, and that time will also be from 3 to 6 p.m. where people will be able to get their second round of the Pfizer vaccine. And we are so thankful that our whole community felt welcome to come to Mount Zion to receive their vaccinations. But I have to say that this is not the work of one church or one group. This was and is a community-wide effort, including not just Mount Zion, not just other historical Black congregations, but also the Black clergy of Lincoln, also our public health officials, also people who just signed up other people to make sure that they got vaccinated. It was the help of people who carpooled. It was the help of people who passed along a flyer or shared a social media post. That indication is that this is a community-wide victory against this scourge and against this pandemic that has affected and influenced so many. As a Christian, I have to say, as a disciple of Jesus of Nazareth, we believe that our Lord is a healer, and we think what better season it is for us to come together and to provide vaccinations and to provide advocacy and to provide access for pertinent health care than this high time of the holiest time of the Christian calendar. So we at Mount Zion, we at the Black clergy of Lincoln, and our other supporters are looking forward to this not being the end of working together with public health officials, but the beginning of a budding relationship that will allow us to address more and other issues of public health and illness in our community. So thank you for your opportunity. Thank you for the opportunity, and thank you, Madam Mayor, for the invitation and the time.
Thank you, Pastor Combs, for your leadership. Thank you to the Black clergy. It was a powerful experience to see your parking lot at Mount Zion packed, to see the eager and enthusiastic volunteers, and of course the people who came to do their part to help end this pandemic. And we look forward to a continued relationship that will address health issues and disparities in our community. I can now say from personal experience how seamlessly our health department's vaccination process runs, from registration to notification to scheduling. Last night, after watching Baylor trounce Gonzaga, as I'd predicted in my bracket, I checked my email. And there in my inbox was that long-awaited message notifying me that it was my turn to get vaccinated. And I clicked on the message, followed the instructions in the email, reviewed available times, entered my birth date, my preferred appointment time, and received shortly thereafter a confirmation email. That's it. It was that easy. I'm set to get my first shot tomorrow at Pinnacle Bank Arena. So like my friend Kim, and like so many of you who've had the opportunity to get vaccinated thus far, I am feeling grateful. Now, before we open things up for questions, we do want to acknowledge and amplify some of the very intentional work underway to address the economic impacts of this pandemic. The City of Lincoln works strategically with local business leaders in the Lincoln Chamber of Commerce through an important collaboration we call the Lincoln Partnership for Economic Development, or LPED. And throughout the pandemic, LPED has pivoted in vital ways to provide businesses and workers with new workforce opportunities. One example of this has been LPED's safe and simple drive-through career fairs. And today, we are pleased to alert job seekers and businesses to another upcoming drive-through career fair. We encourage businesses to sign up for this event that will be held on April 22nd from noon to 7 p.m. at Gateway Mall near 63rd and O Streets. The career fair organizers expect over 500 job seekers. Employers in manufacturing, healthcare, construction, and much more will participate and promote career opportunities for people of all kinds of skill levels and backgrounds. And I want to thank our many amazing partners who are making this important hiring event happen, including the Nebraska Department of Labor, the American Job Center, Gateway Mall, the Center for People in Need, EmployLink, and Lincoln Literacy, along with all of the staff and volunteers. Thank you so much. With that, we would be happy to take any questions from the media.
Hi, Mayor. This is Bill with 1011. I have a question for Pat.
She'll be right here. Thanks, Bill.
Good afternoon, Bill.
Yeah, good afternoon, Director Lopez. Just as a point of clarification, so next week's first dose clinics will continue to focus kind of on that age-based gradual decline, and you'll move to, that 40 to 49 age range?
Right, Bill. And the reason is we have a large population of individuals in that age group, and we're going to continue to focus on those who have been at risk and where we've seen a larger increase number of cases. And so just from that point of view, we're going to continue to follow that way. But our local pharmacies are vaccinating people 16 and over at this time, but we really want to give those individuals, especially those, we're still working on the individuals with underlying health conditions, and we want to move through that way. And I think that's really similar to what Omaha, what Douglas County and Sarpy-Cass have done, is really get through that 40 and then go down 40 and under. And I think everybody needs to remember in Omaha and Sarpy-Cass County, they have multiple pharmacies participating in the retail pharmacy program, so they have thousands more doses of vaccine than we have here. And in our other smaller rural communities, they have many people who aren't getting vaccinated. And so hence the governor and DHHS officials looking at reallocating, and we look forward to having more vaccine next week. So I know I get asked about that, but we're proceeding in this process, and I think the graphs and data that we've shown you have shown that it's made a big impact in our community.
Is the health department going to continue to take the onus of reaching out to people to schedule, or is there a process in the future where people will be able to self-schedule for these mass clinics?
I think what we're doing right now is, and it's really not an onus, it's a real easy process. We have people who are registered, and we're able to schedule them, and we're able to adjust easier and have them come in. We hear a lot of frustration too with other places that people are trying to get signed up and have to get on several times and keep trying over multiple hours to get signed in. And with this process, people know to expect that they're going to be notified by us, and that it makes it real easy for them to schedule. And they still are self-scheduling, as the mayor shared her own experience.
One more question, unrelated. Do we have any documented cases in Lancaster County of positive tests from people who have completed vaccination?
You know, Bill, we're currently looking at that. We have a potential, and I know that the state's looking at some cases, and I can't really speak to those situations. They're under investigation, but we'll be sure and share that when it happens, if it happens here.
So just to clarify, nothing official yet, but there is one under investigation?
Right.
Thank you so much, Director Lopez.
Just as a slight follow-up to that, Bill, I mean, as we all know, the vaccine does not provide 100% protection against contraction of COVID-19, but what's so important for everyone to realize is that the vaccines are safe and effective in preventing the most severe outcomes. They prevent illness, suffering, and death. And we are so pleased that we have such incredible, effective vaccines available. Is it 100% guarantee against getting COVID? No, but it really reduces the severity of outcomes and helps people get through this pandemic with that, a better quality of life. Any other questions from the media?
Yeah, hi, Mayor. Matt Olberding from the Journal-Star. I actually have another question for Pat.
It's Matt, should be right back.
Yeah.
Hi. So you've talked about asking the state for additional doses to sort of meet the demand in the county. Has that borne fruit so far? Have you, like this week, did you get more doses than you have in the past? Not counting the extra Johnson & Johnson, but the normal allocation that you usually get.
Well, the Johnson & Johnson were extra doses that, because a number came into the state, but they allocated those numbers to us in Omaha and Sarpy County, and some other areas, but we did receive a higher number of doses than other areas because of our need here. So they are still working on that. I hope to know by Thursday morning, we'll know what our allocation for next week will be.
And one more question for you. I know, I just personally know of quite a few people who have gone to other counties to get vaccinated at pharmacies. When that happens, do you guys get notified of that? I mean, how do you know that people who are getting vaccinated in other health districts have received their vaccine? To count those in your numbers.
That's a great question. Thank you for asking that. Everyone who's providing vaccine must register who's received the vaccine in the state immunization registry. So we know who's received a vaccine and the date. And we use that registry even now as we're going through who's registered in our system when we're sending out appointment times. Before we send those out, we've reviewed in the state immunization registry who's already received their vaccine, and then we go on to focus on those who still need the vaccine. So we do know, we can look up and see where others have received the vaccine. They have to go back to the same place and receive their second dose because that's how vaccines are allocated. And I do know that several people from Lincoln are going to multiple different places.
Great, thank you.
Any further questions for Director Lopez, myself, or our guests today? Okay. Well, in closing, I want to thank our guests. Thank you to Pastor Combs, to Romeo Guerra, and to Christy Hinrichs, and thank you to Director Lopez and her team. All of you have provided such incredible leadership and partnership in this effort to end the pandemic, and that partnership means so much. Thank you to the media for helping to get out the word so more people know the important role they can play in ending the pandemic. And finally, one last reminder to all Lincoln voters. Today is primary election day for municipal races, including City Council, Airport Authority, and the school board. Polls are open until 8 p.m. this evening, and if you don't know your polling location, you can find it at lincoln.ne.gov/vote. So please make your voice heard, and please go vote. Thank you. Thanks, Margie.